Hello everyone, my name is Rachel Fustall and today we are going to be doing a summary of my systematic review, which is titled Systematic Review of Long-Chain Polyunsaturated Fatty Acid Effectiveness in Cancer Prevention. To begin, my name is Rachel Fustall and I am a graduate student here at Eastern Illinois University. I'm in my second semester of my master's degree program, majoring in dietetics. So first, before we dive into some of the studies I found and what they were saying about the effectiveness of long-chain polyunsaturated fatty acids on cancer prevention, let's first look at what cancer and long-chain polyunsaturated fatty acids are. According to the National Cancer Institute, 1,735,350 new cases of cancer occur each year, with 609,640 people dying of cancer each year as well. But what is cancer? Cancer, according to the National Cancer Institute, is a collection of related diseases, and these diseases all surround cells that multiply without being able to stop and spread throughout the body. This means that cancer is a genetic disease able to be passed along from generation to generation, but it also can occur due to environmental factors, according to the National Cancer Institute. The National Cancer Institute also lists some of the most common risk factors for cancer, which are age, alcohol, cancer-causing substances such as chemicals, chronic inflammation, diet, hormones, immunosuppression, infectious agents, obesity, radiation, sunlight, and tobacco. Now, some of these are not able to be prevented, such as age or hormones, but things such as diet and chronic inflammation can be controlled by a person and thus are the best ways to look at prevention. Now let's turn our attention to long-chain polyunsaturated fatty acids. Zarate, Jaber-Vazesk, Tejera, Perez, and Rodriguez, in their article about long-chain polyunsaturated fatty acids, discussed that most research and most medical attention focuses on omega-3s and omega-6s. The omega-3s and omega-6s are especially important, according to Zarat et al., because of the reduction in inflammation. This reduction in inflammation is prevalent in cardiovascular research as well as cancer research. As I stated on the previous slide, chronic inflammation and diet are risk factors for cancers, so the anti-inflammatory properties of omega-3s and omega-6s may decrease the risk of cancer. Which leads me to the purpose of this systematic review is to investigate the effects of long-chain polyunsaturated fatty acids consumption on the prevention of cancer development. With current research being done on the anti-inflammatory properties of long-chain polyunsaturated fatty acids, specifically omega-3s and omega-6s, without any recent systematic reviews on the topic. This is an important look into whether the consumption in this change of diet towards long-chain polyunsaturated fatty acids could help reduce the risk of cancer development. So next, let's talk about my methods of discovering the studies that I did find. So I used Eastern Illinois University's databases to find this information. I used Academic Search Complete, Google Scholar, JSTOR, and CINAHL with the keyword searches of long-chain polyunsaturated fatty acid and cancer. I eliminated any studies that focused on cancer treatment and animal testing, as those are not relevant to what I was trying to research. And I did focus in on the last 10 years, giving priority to studies done within the past 5 years, so which includes the years 2009 to 2019, with the focus on studies from 2014 to the present. Now, I also did look within these studies to find other research, which gave me my total of 10 studies that focused on the prevention of cancer using long-chain polyunsaturated fatty acid consumption. Today I'm going to be focusing on the 3 studies that I will be discussing in my oral presentation on the 29th and 30th on our 3rd weekend. Baskett et al. Studied 282 African American women over 18 years, looking at their long-chain omega-3 polyunsaturated fatty acid through fish consumption and endometrial cancer risk. They found no statistical difference between normal weight and overweight obese women, as well as that fish intake was not associated with reduced risk. Aram et al., however, found, after evaluating the association between endometrial cancer risk and intake of fatty acids over 1,890 participants, that higher intake of EPA and DHA, which is found in omega-3s, was significantly associated with lower risk. Total fish intake was not associated, but fish oil supplementation was significantly associated with the reduced risk, causing them to conclude that EPA and DHA found in omega-3s may have protective properties. Finally, Eibel, Nagel, Bain, and Webb in 2012, when looking at 1,366 participants in an ovarian cancer study, found no association with high intake of omega-3s and omega-6 fatty acids and the risk of ovarian cancer, reduced or increased, by evaluating risk factors and food frequency questionnaires. Although some associations were found between long-chain polyunsaturated fatty acid consumption and reduced risk for cancer incidence, there's not any conclusive evidence that this should be a general recommendation for those with risk factors of cancer. Further research must be done to understand whether supplementation or just regular consumption of long-chain polyunsaturated fatty acids significantly reduces the incidence of cancer amongst populations. For dietitians, this means that we must continue to read the research as this is a growing topic. Thank you so much. Have a great day.